What does it do?
Hi guys, my name is Erin Flott, and I decided to do my presentation on healthcare services and healthcare within the rural community. I just want to start off by saying that health and well-being are important factors when considering a person's longevity and morality. Compared to urban residents, rural communities are more susceptible to barriers and hurdles when trying to access healthcare services. Since rural residents are unable to access healthcare facilities, then they are more likely to experience severe health disadvantages and illnesses. The reason that rural residents are more likely to experience severe health conditions is because they lack economic resources. Rural areas are often small, spacious areas, which suggests that rural communities have less businesses and less services. Since another important factor to consider when assessing rural healthcare disadvantages is that rural communities often lack accessibility to healthcare services. Since healthcare services are often offered long distances, rural residents sometimes have no means to reach their healthcare provider. Lack of transportation, whether public or individual, is a significant barrier to why residents are unable to access healthcare services. It should also be noted that there's a shortage of healthcare professionals within the rural community. Without a healthcare workforce, health facilities located within the rural area are unable to provide quality and efficient care to their patients. If providers are unavailable within the area, then it limits the supply of available services offered to the rural residents within the community. We also have to take into account that there is a burden of poverty within the rural community. It should be noted that rural residents are more susceptible to poverty than those that live within an urban population. As a result, rural residents are also more likely to be uninsured and uncovered by healthcare insurance. Since rural residents lack insurance, they are more likely to experience physical and mental healthcare issues. A lot of rural residents also lack preventive and screening services. Since they lack preventive care, then they lack the ability to detect early signs of diseases, which then leads to severe diseases and chronic illnesses. Premature death is also increased within the rural community because chronic illnesses are often not found till it's too late. I feel like in order to ensure a healthy style within the rural community, rural residents have to make more conscious efforts and decisions to make lifestyle changes within their life. I think some recommended tips would be healthier eating habits, exercising to promote good physical health, and also undergoing periodic health screenings. I also think having a good, strong support system would also benefit residents within the rural community as well. And that's all.